So the day after the earthquake, International Medical Corps deployed teams to two of the most heavily affected districts of Gorkha and Davin. We were able to drive to both locations, but the areas that are most affected in those districts are not accessible by road. What makes this response unique and really difficult is the access challenge, both getting supplies into the country because the airport has only one runway and it doesn't have a lot of space, and so there's lots of delays in getting supplies in. And then there's challenges in getting the supplies from the airport to the affected communities because people live in these very remote villages that are normally only accessible by foot, and now with landslides and bad weather are really inaccessible. So we now have teams going out on foot, provide mobile clinics, and we're working on mobilizing water and sanitation supplies to reach camps where people are displaced from their homes. International Medical Corps' mobile medical units are comprised of both international and Nepalese doctors and nurses and pharmacists, and they're currently working in several locations inside the capital and in rural districts. Some of them are injuries directly related to the earthquakes, but we're also seeing secondary health issues related to the displacement. People are living in camps. They're exposed to the rain and the cold. We're seeing upper respiratory infections. We're seeing skin issues, and we're really concerned about the possibility of diarrheal disease outbreaks because the water and sanitation conditions are really atrocious in some of these camps. And so we're really working hard to get latrines in place in the camps, to supply hygiene kits, and to make sure that people are drinking treated water. We're looking at really remote areas, some of them up to a 2-day walk, and we're, in some cases, the first people to reach them. Today, one of our teams in Bhaktapur saw a child who had been rescued from the rubble, but still had not had access to medical care. So it's unique to Nepal and a very rugged landscape, and we're trying to come up with ways to get around these problems and make sure that people have access to the care that they need.